14-month-old who fell down the stairs, vomited pretty much immediately. We're going, no meds, no history, no allergies. On the count of 3, we'll move over. 1, 2, 3. And the baby started vomiting. Kind of giving her a GCS for 12 or 13.
All right. Let's start with our primary survey. Weight's 5 kilos by Boswell. Baby's crying, so we know that it has a patent airway, but there's no C-collar on. Thank you for holding C-spine. We need to get a C-collar on. You got it? When they rolled in, I didn't notice any signs of uncontrolled external hemorrhaging, so we'll continue with our ABCs after we get this C-collar on. Okay, you ready? One appropriately fitting C-collar intact. It's a level 5. All right, now that our C-spine's intact, we can move on to breathing. Equal chest rise and fall. I'm not hearing any abnormal breath sounds. Cleared equal bilaterally. No retractions. We'll move on to circulation. Good, strong pulses. Cap refill is less than 3, and I don't see any signs of hemorrhage. Disability, we already said we knew this baby was nice and awake and crying, nice and alert. And exposure, we'll work on getting those clothes off while we're getting them on the monitor.
Our pupils are 3 millimeters bilaterally, reactive to light. I see no obvious injuries to the nares, no blood or hemorrhaging. Your blood pressure is cycling right now. Same with the ears. I see no sign of hemorrhage. Ears are clear. Okay, temperature is 35.9.
All right, let's get some warm blankets on this babe. Here we go. All right, is there anything that you need?
First set of vital signs.
When you exposed the baby, did you notice anything? I'm sorry, I may not have heard that.
No signs of
Okay.
bruising, no deformities, no signs of injury.
You can roll the baby to get them off the collar now, or to the backward. On my count, everyone. 1, 2, 3.
All right. No step-offs or deformity. And it looks like baby's clenching his butt cheeks when he's crying. No signs of poor rectal tone. Roll back over.
All right, again on my count. 1, 2, 3.
So I think that we still need to image the C-spine so we can get an x-ray. Let's do it fast just to make sure there's no internal damage. And then I think we are safe to obs this baby. I don't think that we need any labs or IV at this time because the baby's very well appearing. Vitals are remaining normal on the monitor. How does that sound, everyone?
Sounds good.
All right, we'll coordinate with radiology, and if you could run and grab the fast machine for me.
All right, guys, while we're waiting for this patient, let's just recap real quick. So we do have a 4-year-old coming that was pedestrian struck, has an obvious deformity to the right lower extremity. So I do anticipate we're probably going to have some pain management needs. They were giving her a GCS of 14, so we'll really want to make sure we stay on top of what her neuro status is. And then they said she was a little bit tachycardic as well. So given that she has the right lower extremity injury, I'm obviously concerned for possible pelvis injury as well. So in the meantime, while we're waiting for the patient, let's go ahead and introduce ourselves. I am Christine. I am the PCD airway folk.
Amy, trauma nurse. Laura, trauma tech.
And I'll be the nurse.
Jenna, Jeeps, help do the primary survey.
Hey guys, I got a 4-year-old pedestrian struck about 30 miles per hour, loss of consciousness at the scene, now has about a GCS of 14. This right leg is shortened and rotated. On the count of 3, 1, 2, 3. She's been tachycardic, crying out in pain. I don't have access, so she needs pain meds.
No obvious uncontrolled external hemorrhaging. You can go ahead with the primary survey. Looks like she's got a hard collar on from EMS, so we will want to switch that out to our Aspen. All right, she's crying, talking to us. Okay, we'll give her a nice clear pain airway.
Good job. We're just gonna
She's 14 kilos
take
by
a look here,
Braslo.
okay?
Are you guys getting her on the monitor?
Yeah, I'm getting on the monitor now.
Good breath sound, clear equal bilaterally. No signs of increased work of breathing, no retractions, no concerns from her breathing.
I'm sorry, I didn't catch her GCS.
I haven't got that down that
Okay.
far yet. We're on circulation, see?
Thank you.
I'm gonna cut off her clothes and put her on this monitor.
Nice strong central pulse. I'm getting a weak peripheral pulse, and cap refill is 3 to 4. Let's get some IV access, and we'll grab some trauma labs at the same time, and then we will need to do a fluid bolus. Regular standard fluid bolus.
Her first vital signs are cycling. She's tachycardic. Let me get that new collar while I take care of it.
Have you guys gotten a temperature yet?
No temperature yet. I'm gonna put her C-spine on. I'll grab that.
She's got a 22 in the left hand.
Awesome. We could get a fluid bolus ready to go, and let's do some pain. Keep my pain medicine in mind too. She's still screaming at us.
She's 14 kilos by Braslo. I'm going to start with 14 mics of fentanyl.
Sounds good. You want to draw that up?
Yeah, I'll get it ready.
And are we gonna do a 20 per kilo bolus?
Sounds great. So that would be 280 cc's of normal saline.
All right, our C-spine is confirmed. Where are we at on our primary versus secondary survey now?
We're still finishing up C. We're getting the fluids going. We got access. We'll move on to D. Looking at the patient is awake and alert, but seems to be a little confused. Isn't making the most sense. I will use my pediatric GCS. I'm going to give her a 14.
Temperature
One off for
35.9.
confusion.
Here's the 14 mics of fentanyl.
Thank you.
Can you check the pupils for me?
Her pupils are equal, round, and reactive, approximately 3 millimeters. She does have some abrasions to her forehead, but no obvious signs of bleeding or lacerations. She does have some bleeding at her nares. That looks like, again, from abrasions. And
14
both of
mics
her
of
ears
fentanyl
are
given.
clear
Can I get
currently
some
with
labs
no
with drainage?
drainage.
Yeah, I'll get those stickers for you.
All right, moving on to the rest of her exposure. I see some more abrasions and road rash to her chest and legs.
Her mom's coming in. I heard she's really upset. Just giving you guys a heads up.
Is social work here to talk to her?
I will
Or
get
the
someone
shift
to grab
coordinator? Okay. Let's see. This right lower extremity, it's obviously deformed, and look at the leg is a little bit shorter.
Normal
So-
saline bolus started.
Thank you.
Excellent. We have a repeat set of vital signs.
And that was 240 or 280? I apologize.
280.
Thank you.
The patient's still tachycardic. Most recent blood pressure is 80 over 35.
Should we cover her and keep her warm?
Oh yeah, good
Her
call. Let's put the
temperature-
warm blanket on. Finished up with our primary survey, so we're going to move on to the secondary survey and do a head to toe. I'm really worried about this pelvis, so I'm going to check for stability. Pelvis seems stable. All right, pelvis appears to be stable. I'm just concerned about this right lower extremity. Work down. So we're going to definitely need to get some imaging of that. I think we're going to need to do some C-spine imaging. Let's get the chest x-rayed, that right leg completely. We should probably scan her head. She's GCS 14. We got the fluid bolus, got the fentanyl. Let's also, can somebody grab me the fast? I want to check her belly. It's right there by the femur.
Repeat blood pressure is improving.
Should we get her off this backboard? I know it's going to be pretty painful, but we got the fentanyl in. We'll support the leg and we can roll her.
I'll hold the light.
Okay.
And on my count, everyone, on the count of 3. 1, 2, 3.
My baby! What are you guys doing to my baby?
Ma'am, we're just taking
Mom,
care
we're
of
just checking her out, okay?
Okay, let me check the spine.
Trying to get her more comfortable.
Honey, can you squeeze your butt?
You're hurting her. You're hurting
Oh,
her.
she's squeezing them a little bit when she cries. You can roll her back over.
All right, again on my count. 1, 2, 3. All right, sweetie, good job, okay? We're gonna just take some pictures of that leg, make sure everything looks okay.
Somebody call an x-ray?
X-ray being called.
Oh man, this fast is negative. Are any of those labs back yet?
No, you know the lab.
What about CT? Think we can go over to CT?
Let me call them real quick.
What's your pain score now? Is it improved after the fentanyl?
Can I get another set of vitals, please?
Vitals are running. She seems to be more calm. Let's use a flash to calculate her pain. I'm giving it now a 5 rather than the 8. Got our travel monitor. Let's put her over to the imaging. Can we get somebody call ortho? We gotta do something about this leg.
Can you put those orders in, please?
You got it?
You gotta tap in first.
Oh, sorry.
Ah, be careful with the leg. All right, let's roll. Oh, fluids are coming along. It's kids coming.
All right, guys.
So let's
If someone could help me, thanks. So we've got an 11-year-old who's in an MVC. They were ejected. One with the GCS of 3.
Let's quickly, 1,
1,
2,
2, 3.
3.
We've got an IO in place. They're really hypertensive and tachycardic.
Airway, she has
Couldn't get a
obvious
history.
debris in her mouth and having difficulty bagging.
She's really not breathing regularly. It's shallow.
I'm gonna want 2 IVs.
Yeah, definitely 2 IVs.
What's her weight so I can start getting drugs ready?
This patient's weight is 15 kilos.
I'm not hearing good breath sounds at all.
I don't have good chest rise with my.
We're definitely gonna need to intubate. Can you get RSI meds ready for me?
Do you want an oral airway?
Yeah, let's do an oral airway.
Can someone tell me why this is an alpha?
We're really working her. She's got a really low GCS. And let's see, the pulses.
Okay, your first set of vital signs are up. This patient is hypotensive.
I'm really not feeling good pulses. They're very weak and I don't feel anything in the periphery.
I'll get some normal saline ready. Here's the
Perfect.
intubation drug.
This patient's temperature is 35.
Gotta make sure we're keeping them warm.
Here's the warm blood kit.
left AC.
GCS is still, GCS is at 3.
Yeah.
Her pupils look fixed and dilated.
I'm gonna start
we're
a
gonna need to get
bolus
CT.
on this side.
There you go. I have it warmed. I have
Call
it
CT.
Perfect.
Yeah, definitely need to do CT. There's a lot going on
Where
here.
are we with her RSI drugs? I'd really like to intubate this patient sooner than later.
I have them right here. Are we ready to start?
Yeah, let's get this patient
All of our
intubated.
equipment.
I have my suction, I have my tubes, I have my blade, I have my glide scope
We use
by
it
in
as
case,
access over
considering this is probably gonna be a dart with her debris in her airway.
What debris in her airway do you see?
I see loose teeth, there's blood, I can't tell if the blood's coming from her mouth or her palate.
Does anyone
or
need to suction
her
her?
airway.
Yeah, we got suction.
Yep, she's been suctioned. Suctioned, got a lot of blood out. Can we get those trauma labs sent?
Trauma lab sent.
Printing stickers.
I'm gonna give the lighted cake first. Is everybody ready?
Yes,
I
airway
can't
is
find
ready.
her armband. Does she have an armband on her already?
Ask for it.
All right, and
Just
vitals
under
are
the
up.
wrist.
Your new set of vital signs are up. This patient is still hypotensive. I've been giving this bolus,
About how much have you given so far?
half a liter.
Lighted cake's in. I'm gonna go determinate now.
Can we also have Epi on standby? I'm very concerned she could arrest during our intubation.
Epi is on standby.
Will you put her on the Zoltan while you're waiting?
Trauma labs, can I get some
Yes.
of those, please?
Yes. You get her on the Zoltan, just in case.
Giving rocks right now. Is everybody ready?
Okay.
Guys, I'm really not feeling a pulse. I think we need to begin compressions.
Uh-oh, we start CPR. I'll continue to plan to intubate while you're doing
Will you
that.
bring a stool?
Compressions are
I
started.
got Epi right now. I'm gonna give the first dose.
Why don't I go ahead and take over compression?
Yeah, I'm gonna
for you,
start to
so
put
you
a
can
test
finish
tube in.
the 2 on your count.
And then I need,
1,
this
2.
patient is still
Three.
hypotensive.
Do you think I should get blood? Are we ready?
Yeah,
to
I
get
think we're
blood?
gonna need some blood.
Think about the
Can you just
NTP.
turn that Zol towards me a little
Let's
One
bit?
call
more
for
second.
NTP.
I am about to get the tube in.
I called
Okay.
the blood bank. Somebody's getting a cooler now.
Okay. And then after we secure this tube, we need to roll this patient.
All right, everyone, I have a 14-5 or 4-5 ET tube in.
Would you grab me?
Can you give me the
an
chest tube?
I will. We're starting the blood now.
Thank you.
Can someone listen for breath sounds with bagging? I do have end-tidal to 36 with my bagging now.
I hear breath sounds. Clear breath sounds, bilateral.
All right, so again, we have a 4-5 ET tube in at 17 at the lip. We are doing compressions. We have fluids going.
gotta
We
get that.
have blood hung
Yeah, blood just
already.
started, and then when you're ready, we need to roll this patient.
Have we given our epi?
Yes,
1, 2,
we're supposed to be
3.
good.
There's the NG tube.
Thank
All
you.
right, our
is
back
on.
pad is
Can I get that
on.
chest tube?
Have someone monitor for high quality CPR while we're working on the chest
I have the
tube.
chest tube.
Over for you when you're ready.
12 French OG tube, please. Did someone call X-ray?
I'll call X-ray.
Chest tubes in.
What size?
Oh, I don't know. What size
Okay.
is this?
What? It's on the right side or the left side?
Okay.
Thank you.
12 French on the right side. Right
Thank
side.
And you have a large volume of blood coming out of the chest.
And we have the MTP cooler. Are you ready for the next?
Do we have hypertonic saline?
Has
Yeah,
her,
let's get some
has her
hypertonic
pulse
saline.
ox changed at all? I can't see the reading. Can someone make
Yeah.
sure that's on her finger?
We
Is her
have
breathing
no vitals
changed?
currently registering.
Got
Yeah,
blood
we're
pressure
ready.
timing out.
CPR is
Hypertonic
ongoing.
right now.
Perfect.
We've got
Can you put
hypertonic.
hypertonic in her other access while I finish the
Yes.
blood? Okay. 1 unit of blood given.
We're waiting for the MTP coolers. We have our airway established. We're still in active arrest.
Are we almost up for the next dose of epi?
How many minutes?
It's been 2 minutes, so we have 2 more minutes.
Okay. We got our labs going. We got our airway secured. We're resuscitating with fluids. We are giving blood. Done hypertonic. We're doing our cardiac arrest management. Chest tube is in.
It's,
Gotta
I
keep
can't
working on
see
this
the
fit.
monitor. Does she have an end title?
End title is still currently picking up in the 30s.
Okay.
Last read was 32.
And still no blood pressure?
Still no blood pressure, still no vitals. Her color is very pale.
There's a
She
lot
is
of.
not fighting the tube at all. We have not given additional RSI meds at this time.
We give this second dose epi now?
We're at 3 minutes and 30 seconds.
Oh, okay.
We'll
Do we
prepare to
wanna
give
look at-
epi shortly.
do we finish the
Do
rest of our secondary survey?
survey.
Lots of abrasions, lots of wounds. Pelvic is stable. Oh, just kidding. Pelvic is not stable. Can we get a pelvic binder?
Yes.
Oh, I'm feeling a lot of wobbling. Let's get this pelvic binder on this kid. Maybe that will stop the bleeding.
Good compressions. We're still getting chest rise and good end titles with bagging.
Still no blood pressures?
Still no blood pressures.
Okay,
This is nice
pelvic
and tight.
binder.
CT
applied.
says they'll be ready in about 3 minutes.
Is it time for the epi?
X-rays coming. Yes, epi is time.
Okay. Second epi is in.
Will be like another unit of blood.
Yes, let's continue with MTP.
We have the cooler here, so
Oh, the cooler's
I
here.
can help you.
I just started this.
And then can we make sure we have all of our meds ready to travel for CT? We'll prioritize getting to CT and then up to the PICU.
Do you want to switch CPR or do you want me to grab the stuff and you can continue?
We should switch.
I can step in for CPR.
All right,
You wanna go
everyone,
grab the
just to
monitor and
summarize, we have a 11-year-old that's in full cardiac arrest after a traumatic event. We have an ET tube in place where we have patent airway at the moment through the ET tube with good end titles. We are in active arrest with high quality CPR ongoing. We have activated the
right, on your
MTP with blood actively going as well. She has been in cardiac arrest throughout. We are concerned that she
Can you
had a
just hang
severe
that on
head
then?
injury as well as a pelvic injury. She had a large amount of output from her chest tube that is still continuing to drain. Our priority now is to get imaging and CT and then go upstairs to the OR or PICU from there. Is everyone in agreement?
Yeah.
Yes. All right, let's get ready to mobilize.
Hop on the stretcher then.
And C.
I was just kidding. I was hoping you straddle.
Oh.
No, I mean, I mean, for the purpose of.
Okay, well, we don't need to